In light of Thanksgiving, I thought we'd talk about gratitude. And I thought more for contemplation, this quote that I came across by Aldous Huxley: most human beings have an almost infinite capacity for taking things for granted. So, what is gratitude? What does it mean to you?
I think it means pausing your day and stopping to smell the rose.
Yeah, sometimes gratitude can take a moment of reflection and a recognition of what's there and present, and not take it for granted. So thank you. Other thoughts? Yeah.
Being able to walk far away from the grocery store, park the car far, and then walk to the grocery store.
You're grateful for that.
Yeah,
that's wonderful. Yeah, I think it's actually a good habit, and the ability to do that's great. Yeah. Chris?
Say, having something meaningful and the feeling of thankfulness for that, like being called to medicine or nursing or whatever field people are in, and having meaning in what you do every day, not just mindlessly shuffling paper for a paycheck.
Being able to find meaning in what you do, I love that. I felt grateful yesterday. One of our patients decided to stop breathing in the PACU, and it caused a bit of a stir, and then Chris showed up and calmed everything down, which was, I was grateful for that. So thank you. Other thoughts? Michelle?
For me, part of gratitude is keeping a good perspective.
Yeah.
Getting too focused in and not seeing.
Gratitude does require some perspective, yeah. So I think it's part of the reason we're taking a step back today on it.
I think I'd also add, taking the moment to share something that someone else did that impacted you positively and letting them know that.
Yeah, very good.
I was going to say a focus on positivity and just the good that the world offers you.
Yeah. Thank you. We could continue, but we have AI, so we don't really need to. This took about less than a second to learn what gratitude was. What are the health benefits of gratitude? And I did some reading on this. There's a lot. It's not just this virtue that is just nice. There's a lot of health benefits to gratitude. So what are they?
I've actually read that it affects your hormones.
Yes.
So it can, how thankful you are and how positive mindset you are can affect how you react to things and affect your hormones and results, which affect your health. So.
Yep. Very good. Very good. Yes.
Kicks you into your parasympathetic nervous system, get you out of that fight or flight, which we know all the benefits of being in more of a calm, relaxed state, improvement in genetics, and there's so many benefits.
Yeah, for sure. Thank you. Other things? Back to hormones. One of expressions of gratitude cause a noticeable spike in dopamine and serotonin, and can literally have that kind of effect on our system.
We know the benefits of those hormones. It's like a hidden drug.
Yes.
It feeds itself. So the more grateful and gratitude you express, the more you feel.
Yeah.
And it's just a continuous cycle.
Thank you. Jennifer?
And pain management.
Yes. How so?
By recognizing the positive and the good instead of funneling all of our energy into, oh, this hurts and I feel really lousy. When we distract our brains from that constant, oh, this is hurting, then those distractions can decrease that, especially the centralized types of pain.
Yes. Very good. Steve?
It goes back into that perspective. Like if we look at our life, that we're, everything is wrong, then we will hurt more. We will have more difficulties with things. But if we look at our life as that we have a perspective that, wow, we got up out of the bed this morning without even thinking about it, did all these things, you know, yeah, I have pain, but our pain isn't that bad. People have it a lot worse than I do.
Mhm.
You know, I think that it can make a huge difference on the way that we feel.
Mhm. I think so. Yeah. Thank you.
One other thing, I don't know if people are familiar with Bruce Lipton, a researcher that was teaching genetics at medical school and teaching the influence of how genetics controls some of our diseases. But he was one of the first to pioneer researching on stem cells, and he took stem cells and grew them in a petri dish and divided them up. And he started studying the effects of different chemicals and hormones on different petri dishes, and found that people with stem cells could convert themselves to muscle, to bone, to ligamentous tissue, depending on what chemicals were in the medium petri dishes. And he started studying cancer cells and put the hormones of stress in the same petri dishes, the cancer cells that kept them alive. But if you put the hormones that are associated with gratitude and love, which, oxytocin, it actually reversed the cancer. The cells reverted back to normal cells. They were no longer cancerous. And so, which led to another area of science, epigenetics, studying how the effects of these chemicals from our thoughts affect the environment of the cells and how they manifest, whether they both turn to cancer or stable.
Yeah, thank you for sharing that. I think it's really important to recognize that there's some real science behind the effects that expressions of gratitude can have. And it's almost as if we would want to prescribe gratitude to our patients, which sounds funny, but and again, we have AI to answer the questions. But the list is significant. And one of the ones that I noticed is that in the concept that we've talked about, where exercise, nutrition, and relationships were a foundation for health, gratitude really helps strengthen relationships, and it can create and foster relationships around us, which is a wonderful thing. So the other day, I saw this patient came in with it's supposed to be playing, a tumor in the skull. And I didn't know what tumor it was. It turned out to be a large B-cell lymphoma, which in retrospect would have been really hard to diagnose. But she had swelling of her eye. It had gone into her orbit. It had gone through the dura, and it had invaded the pia of the brain. There was some edema in the brain itself, and really had this idea that we should probably remove all of the tumor, get a diagnosis, and then we're left with this challenge of how to reconstruct it, right? Because I took the top notch of her orbit off and all of this bone. But thanks to some nice medical technology, the reconstruction was really easy. All we did is close the wound when we were done, get a CT scan, send it off, and they created a MedPort implant that perfectly fit the defect. And as I've reflected on that, it's so nice to have improvements in medicine that we can offer to patients. And it made what could have been a much more challenging and difficult situation, from my perspective, relatively straightforward. The surgery was, it is what it is. But when we go to do the reconstruction, that aspect of it was very simple. So this is 2 weeks later when we've 3D printed the implants. There it is, and again, once we got the wound exposed, just put it in the defect. It fit perfectly, and we were done. So I wanted to ask you, what medical advancements have you found to be most beneficial to you? What things in medicine have impacted your practices and enabled you to help people? Or what are you grateful for? Alex?
I think the relationships in this room has been very helpful and impactful.
Mhm.
And getting to know everybody and understanding different perspectives and how each of us interact with the same patient in a different way and see things under a different lens. I think it's been very impactful and opened my mind to broaden my perspective,
Yeah.
seeing the whole patient.
Yeah, very good. And there's so much subspecialty anymore because there's so much to know and so much to offer that being able to come together allows us as a community to offer a much more comprehensive solution to patients. Steve?
I'll be honest, as a new provider, it's really nice to be able to type something into UpToDate and get all of the
Yeah.
medical research
Yeah.
behind it. I have an idea typically when I walk in and I see a patient, but it's sure nice to get that perspective from 1,000 other people that have had the same thing and
Yeah.
are seeing it, and then provide us the recommendations, and we can use medical knowledge to go behind that and do what we feel like is best for that patient.
Yeah, I agree.
It's a beautiful thing.
Yeah, you have so much at your fingertips. Yesterday, there was a patient with a 4 millimeter schwannoma in her internal auditory canal. And so I was just wondering, am I making the right recommendation to do an MRI, a repeat MRI in 6 months? And so I just looked it up, and yeah, that was the right recommendation. And so then it took me like 10 seconds. I didn't have to recall, all that information. And so we do have a lot of medical studies out there, and they're all very readily available. I love that comment. Thank you. Yeah.
Just the fact that I can use a computer to document. And I remember when I was in 8, we're using paper charts.
Yeah.
Putting everything down. It was just, our EMR went down about a year ago, and we had to reinvent the wheel with some paper charts, and I'm like, this is crazy that we used to do this.
I'm glad you brought up the EMR because I think it's a little bittersweet, right? It's definitely a source of stress and burnout for providers and caregivers, and at the same time, I think it's like complaining about white light in a room when we used to have little candles and stuff. It's a benefit, and we should recognize that yes, it has its issues, but at the same time, I would much rather do charting and not have to read somebody else's scribbling on a computer.
I think the older we get or in here, we can date ourselves of having to run X-ray through, film and actually having to go through film, processor. If the patient moved.
Every night.
Blame it on the patient. Blame it on ourselves or something. To have digital images.
Digital imaging in general, digital imaging. I sit home every night reviewing cases, and I can pull up all of the relevant information in my basement.
MRIs came out like in the 80s, the early 80s.
Yeah.
Think about it.
Yeah.
Now you can look at this real quick and 3D print something that.
Yep. It's pretty cool. Yeah.
Piggybacking on Brad's comment, you mentioned AI a couple times today. We've been using a feature in our EMR that will allow me to just push a button, and then all I have to do is talk to the patient. I don't have to type. I don't have to bury myself in the computer. I can listen to them. I can get the gist of what they're there for. I can and really bond with them over that too. And then it does the work for me, which is really nice, and uploads things into the place in my chart where I need them. So pretty cool.
Yeah, and it's almost like that attitude of gratitude opens up your ability to implement technology and use it to the benefit rather than just be afraid of it or something. I love that. We're experimenting with some of that in our clinic right now too, and I'm hopeful it improves the provider-patient relationship and gets us off the computer more, but we'll see. Other thoughts? Yeah.
This isn't a medical advance per se, but I'm really grateful for Google Maps.
Yes.
Community at home health, so and this is gonna date me too. My son makes fun of me. I still sometimes say MapQuest that. I used to have to go onto MapQuest and print out where I needed to go, and now I just put it in Google Maps.
There's a device called a TomTom, I think, that got me through my residency interviews. Driving through Atlanta on my way to and from Gainesville, Florida. I don't know what I would have done without that thing. And now it seems archaic, but didn't have to pull out the Rand McNally map, that's for sure. But yeah, when I went to interview in Iowa, I got there late at night. I didn't really have a map, and I got completely lost because it is flat and dark, and I had no idea where I was. So yes, that's a wonderful advancement. Okay, I'm going to tell a story, patient story now. I think some of you have heard this before. So we were operating a few years ago and found out that this backcountry skier had crashed and was stranded up on the mountain, but he had a head injury. That's what we knew, was a head injury. And so he eventually got off the mountain. He came in hypothermic, had been outside for 5-6 hours, stranded. And he had actually not so much a head injury, but his ski had scalped his head. And then he had fracture dislocations in his cervical and thoracic spine and was paralyzed. So we operated pretty much the entire night and corrected the best we could his fractures and sewed up his scalp laceration. And then, other than being paralyzed for the rest of his life, which there was just no way he was going to regain function in his lower extremities, he had all of these short-term problems to be worried about, some of which are life-threatening. He had been in the hospital for 6 days, and it snowed. And ironically, the snow would have prevented his injury because he was on light cover and caught some brush underneath the snow. And they took him out to the curb outside the hospital to be outside in the snow. And so I thought, I wonder how someone in his situation would handle that. And so I asked him, so what did you think when snow is one of your favorite things and you're struggling with all this stuff and you get taken out to the curb to watch it snow and knowing that you can't really enjoy it the way you did before? And his comment to me, which I'll never forget, is, I was just grateful to be there. He's gone on to do all kinds of stuff. We've skied with him, and he's just been a really wonderful example to me, and a wonderful example of how gratitude enables healing in patients. So I wanted to just offer some time, if you've had a patient in your experience that has had a positive impact on you, if you would like to share that story with us. Steve?
I just got back from a 10-day humanitarian trip to Guatemala.
Uh-huh.
And we were serving the people in the Mayan highlands, 8,000 feet, 8,500 feet in the mountains, in these tiny little towns that no one has ever heard of before. And I remember going into this one, the whole week. We saw 550 patients in 5 days, and the perspective, all the things that we've talked about today, those people have nothing. This meeting would be like going to outer space for them. They have no idea that this exists. Yet their happiness was off the charts. They, just talking to them, I remember this little 80-year-old man that came in, and he didn't speak any English. He spoke Mayan only. He'd never been out of his village of 200 people. He was a farmer. He worked in the fields all his whole life, and he came in and he was bow-legged, and he was obviously what I would expect in pain. And he came up to me and he shook my hand, said something in Mayan, which was interpreted as, "Thank you for being here." And he sat down and we chatted, and it was a three-way discussion in Spanish to my end and back, and I just remember all he asked for was ibuprofen for his aches and pains. And I gave him what he needed and some blue muscle rub, and we got from the dollar store, that would have cost them $30 down there. And I just remember he got up and he shook my hand, and then he gave me a hug. And he just said, "Thank you" again. And then he just walked out. And I sat there and thought, and it was like, wow, they have absolutely nothing, yet they have everything. Yet they're happy. And you walk down there and they say thank you to you every time. And before you even treat them, they say thank you. Thank you for being here. Thank you for living. Thank you for doing all these things. And there's a bunch of the Mayan stuff that goes into that. But it brings me back into a different perspective.
Yeah.
Every time I go on that trip, I've been 3 times now, and I come back, I have a different perspective of how do I treat my patients? How do I see them? Actually see them for more than just a patient. Do I see them as a person and what they're going through, and do I treat differently?
Thank you for sharing that. That's a wonderful example, and it's a good thing to think about.
When I was a nurse on the floor, I had the sweetest little lady. She was probably like 75 at the time, but she had lung cancer, pretty significant, and was going to pass away. But I loved going into her room. She'd been on our floor for a while, because you'd say, "How are you today?" And she'd say, "Oh, just wonderful." And then every person that she'd come in contact with, or her kids would come, and she'd just like positivity radiated from her. And I just remember thinking, like, someone who was in like at the end of life situation could be very negative, but watching her perspective on how everything was wonderful just really impacted me. And I think I tried to take that with me in my practice, and like, it can be whatever you make it. And so hopefully we can radiate positivity to help not only ourselves but also others.
I love that, and I love in our professions to have this wonderful opportunity to learn from, interact with, and benefit from relationships with lots of patients at all different stages of life with all kinds of different problems. And I think we all have stories to share in that regard, but something to think about. A couple of years ago, we went to Glacier National Park, and this was one of the things we did. On the picture on the left, Alex and everybody looks pretty happy. And then on the picture on the right, I think he's kind of wondering why we're doing this. The backstory is that we actually got up at like 4:30 that morning and did the Going to the Sun bike ride in the rain, and it was cold. And so naturally, this was our second activity of that day. But in all seriousness, I've got a couple of my kids in the boat and several of my colleagues and friends, and I think about this journey of kind of in it together. And it would just be impossible to imagine doing what we do and even living just life in general without having friends and colleagues and loved ones in the boat with us. And I'm just very grateful for so many along the way. We don't have a lot of time to dive into this question, but maybe a comment or two about who has helped you along the way. Who is it is there someone that comes to mind as you think that has been there for you or made a difference in your journey? Yeah.
Not trying to get brownie points or anything, Scott. No, I work for Dry Creek, and I've been practicing for about 18 years.
Mm-hmm.
So I've had multiple employers, right?
Mm-hmm.
But Dry Creek's like the first employer that has actually said, "How can we help you?"
Mm.
It isn't, "What can you do for us as a company?" you are an asset. What can we do to help Heather grow? What can we do to help Heather be a better provider? And that is something I'm eternally grateful for.
Thank you for sharing that. I should try to use that at Summit, rather than, anyway, I'm just kidding.
Yeah, you really should.
I love that. And we have a lot of admiration and respect for Dry Creek and many of really all of the physical therapy groups, it seems, and a lot of the other groups in our community have really figured out how to make the working environment be a positive one, and it really does. It makes a difference. Thank you for sharing that. Yeah.
I've spent most of my life in healthcare as a patient, and it honestly just brings tears to my eyes, the people that have helped me along my path.
Mm-hmm.
I mean, the surgeons, the physical therapists. I remember I was in PT when I was 17 years old, and I had a complex 17 fractures in my leg and compartment syndrome, and I couldn't move my toes, I couldn't move my foot. I remember it was actually a tech, an aide, that looked at me and said, "You're an athlete, you'll get through this." And I just remember going home and I just thought, man, you're right. And I learned how to walk again, I learned how to run again, and there's so many people, so many nurses. I remember seeing nurses' faces. I can still see it today. Walking in my room at 4:30 in the morning with a smile on their face, and those moments are what give me drive to help more people.
I love that.
Because they've helped me so much.
I love that. Thank you for sharing. That's a great story. Chris, do you have one maybe final comment?
Yeah, I'm just really grateful to every preceptor, nurse, physician, other types of specialists who have taken the time to teach me something incredibly useful that only their profession would know, and how to solve problems. And all the best ones always kind of said some variation of this same thing, which was, hey, I'm going to teach you how to do this, or I'm going to teach you how to figure this out. But you got to promise me you're not just going to keep it to yourself. So I'm really thankful for those people who've taken the time to teach along the way.
Yeah. I think all of us have had mentors and teachers that we could reflect back on and realize that where we are is not of our own doing as much as it is a community effort. So thank you so much. I just wanted to conclude with this quote, which I've pondered the last couple of years since I read it, and I think it's relevant. So both abundance and lack of abundance exist simultaneously in our lives as parallel realities. It is always our conscious choice which secret garden we will tend. When we choose not to focus on what is missing from our lives, but are grateful for the abundance that's present, love, health, family, friends, work, the joys of nature, and personal pursuits that bring us pleasure, the wasteland of illusion falls away, and we experience heaven on earth. I'm grateful to all of you and for all that you do, and I think that it is a wonderful thing to practice medicine in our community, because we have such great patients to work with, such great people to work with, and I feel it's a privilege to be able to do what we do, and I appreciate you coming in this morning and sharing your thoughts, and again, very grateful for each and every one of you, and hope you have a great day and a great week.